Hi everyone, great interaction on Forum 2. I like that you guys really got into the discussion and, really were able to express your opinions. And keeping in mind that the forums are designed to simulate classroom discussion, so you should always be willing to express your opinion, and we should always have respect for the people's opinions, even on controversial topics, which is kind of how we got into it. You guys got into some controversial topics this week. So I thought I'd just wrap up a little bit from this forum and throw some ideas at you that you can think about. So first of all, just the idea of genetic counselors. People had some ideas about what their role is, but in general, what they do is their job is to simply assess the risk of any children who may inherit a genetic disorder, and they assess that risk based upon a genetic analysis of the parents or pedigree analysis of the parents and or their other family members. So essentially, people who go to genetic counselors are typically, but not always, but typically people who have genetic defects that run in their family. Their job isn't necessarily to give opinions. Their job is more to just assess the risk and give the parents essentially a number. What is the percent risk of that their children might inherit some genetic disorder. And then I also want to make sure that we knew the difference between carrier versus prenatal testing. So carrier testing is, does a particular disorder run in your family? Does a particular person carry the defective gene? They don't have the disorder, but they could carry the gene. They could be carriers, which means that there's possibility they could pass it on to their offspring. Now, prenatal testing is literally testing the fetus for the presence of a genetic defect. Okay, so let's get into some of the things that you guys were discussing in the forum. So, is it ethical for a couple to have biological children if they know there is a chance that a child might have a genetic disorder? And that's a really tough question, but I thought I'd just give you a couple of things to think about here. Now, does it depend upon the disorder? What if it is some horrible, incurable condition, some fatal condition that will cause death shortly after birth? What if it's some horrible disorder that does not cause death, but is actually quite painful? Might cause pain and distress. What if it's something debilitating but actually manageable? So does it matter what the disorder is? And how do we define disorder? And that's kind of can be a tricky thing, because to some people, what might be a disability might be sort of normal to someone else. What about a couple who are both deaf and they decide that deafness is not a disability, and whereas a couple with normal hearing might decide that deafness is a disability or is some kind of condition that might warrant testing to see if their child was affected. So we have to think about how we define disorder. Is it ethical for a woman or a couple to terminate a pregnancy if the fetus is known to have a genetic defect? Now I'm going to ask the same questions I asked before. Does it depend upon what that disorder is? Is it fatal? Is it painful? Is it debilitating but manageable? Does it even matter? Does it not matter at all? And again, how do we define disorder, or does it not even matter? And again, so my purpose here is to simply give you something to think about based on the discussion that you guys were having. Again, a great discussion, and I just wanted to kind of give you some talking points as to how you can help define and describe and delineate your discussion and your opinions. And then we talked a little bit, or I introduced a little bit, the idea of pre-implantation genetic diagnosis and something called germline gene transfer. And that plays into this for a couple of reasons, because it is a method of genetic testing. So let me just give you a quick little summary of what these two techniques are. Now, prenatal genetic diagnosis, very quick. You have a woman who typically, but not always, but typically would be, the prospective mother, and she would be given fertility drugs so that she produces multiple eggs in 1 month. Those eggs would be fertilized in the lab, so outside the body. That's known as in vitro fertilization. The embryos would be formed, and those embryos would be analyzed, not by a microscope. This is just a something descriptive here. They would be analyzed using special genetic analysis, and to find out which of these embryos contain the genetic defect and which do not. Now, obviously, this would only be done if we know that the prospective mother and or the prospective father do carry some type of genetic defect. Now, only those only those healthy embryos would be transferred back into the uterus, so that now the woman would give birth to a genetically healthy baby, or at least with respect to that particular genetic defect, whereas the ones that contain any embryo that might contain a genetic defect would be discarded. Now, germline gene transfer, what's that? Actually, I'm going to go back again. The idea here for germline gene transfer is if, say we have these 5 embryos, maybe only one of them did not carry the genetic defect. Maybe 4 of them do. What do you do with the 4 of them? Well, currently what's done is they're just simply discarded. But what if we could correct that genetic defect so that if we don't like the idea of tossing out human embryos, if we could correct that genetic defect, then those embryos would also could also be transferred back into the uterus, and you wouldn't have to discard them. So that's the idea of germline gene transfer. Where that's currently now is right now what's being proposed is the idea of mitochondrial transfer, where here is the mother's egg, and the nucleus, which is what contains the genetic material, would be removed. And they're showing you here, there's the nucleus right there. They're moving a little bit of that cytoplasm, a little bit of that egg. And then all these little dots here, these are the mitochondria. And this is somebody else's egg, essentially, a donor egg. And so what the idea would be was to take the nucleus from the mother's egg and transfer it into a donor's egg, the donor egg from which that nucleus has been removed. The idea here is that if the defect is in the mitochondria, okay, so the mitochondria are the power plants of the cell, there can be a genetic defect in this particular little organelle. It has its own DNA. Though essentially what it is a nuclear transplant. So you're still getting the genetic instructions from the mother, but you're getting someone else's mitochondria, and then fertilize it in the lab. So that's where germline gene transfer is now. We're not at the point of being able to actually genetically alter human embryos, but it's kind of, the idea is out there. So the reason why I want to go over this is that I want to give you the something to think about here. Is it more ethical to discard an embryo before transfer to the uterus, rather than terminating a pregnancy? Is one more ethical than the other? And if so, if pre-implantation genetic diagnosis if that's something that's ethical, should it be a form of preventative medicine? Should it be covered by insurance, which is currently not, and it's actually very expensive. Now, if a woman decides to terminate a pregnancy based on the results of prenatal testing, is this the same or different from parents who make run-of-the-mill medical decisions for their children? Or they might not be run-of-the-mill medical decisions, in terms of treatment. What about removal from life support? That is something that, would be a difficult decision for parents. And I think we would all agree that that's something that the parents should have the ability to do. Is that the same thing? And, in this case, we'd be looking at quality versus quantity of life. And now, one of your classmates brought up the idea of abortion, and many of you kind of jumped on that topic. So I just wanted to very quickly go over, some of the arguments that surround this topic. So in order to think about it, we have to think about how we define life. Do we define life on a cellular basis? On a cellular basis, does that cell use oxygen? Does that cell replicate? Does it use its DNA? Things like that. But I also want to leave you with a couple of ideas. Consider these scenarios. Suppose a man has a child who needs a kidney transplant, and let's say that child without that transplant would die, and the man is the only match for his child. So think about, can we as a society compel this man to undergo this serious medical procedure of the removal of a kidney, possibility of side effects, in order to save his child? And is that the same or is that different from compelling a woman to undergo medical intervention to carry a pregnancy to term? Because even though it is routine and it shouldn't cause any problems, it is, a medical, it is an invasive medical process. Secondly, when we're thinking about when life begins and how do we define life, suppose there was a fire at a daycare center. Would you risk your safety to run inside and save the children? I think most of us probably would. But suppose there is fire at a fertility clinic where there is a portable but, very heavy and very cumbersome freezer that contains frozen human embryos. Would you risk your safety to run inside and save the embryos? So I give you these things as something to think about. When do we really define life? And is there really a difference between an embryo and a child? Is there a difference between the quality versus the quantity of life? And my job as your instructor is not to give you the answers to these, because it doesn't matter what my opinion is. What matters is that you obtain all the information you can, you get all the facts, and then you are able to make an informed and educated opinion about these particular concepts, because these are difficult concepts. There's not always a clear right or wrong answer, very gray areas. But if you have all the right information and you can think about things from different point of views, that will allow you to make an informed decision. All right, well, great interaction this week. Thank you so much for a very enjoyable forum. Keep up the great work. Thank you for listening.